Hello everyone, and welcome to Simulation and Learning in the 21st Century. I have designed this little mini course to represent Code Blue simulation training, and I have named my class Nursing XX7. Your prerequisite would have been to take Nursing XX6. So let's move away from the simulation lab, and as of 8/3/15, we're ready to go. My name is Cindy Nelson, RN, BSN, CCRN, and I will give you my digits and my information at the very end of this class. Let's go. So our objectives today are going to be Code Blue and reasoning why we would want to use simulation training versus just doing our didactic learning in the classroom prior to moving on into taking care of patients. Number one, it really helps improve team leader performance. You cannot ever be able to practice team leader performance without first having some sense of what it's like to work under a stressful situation with a bunch of your coworkers or some fellow students. And it is always best to always get those graduate nurse skill levels up to par before you do have to take care of somebody in a life-threatening situation. This will help you utilize innovation teaching knowledge. Decrease shortages of training sites is one reason that we need this. There just isn't any more clinical learning at this time. This also increases patient safety. It assures standardization of evaluation and assessments. And, going with the standardization is just the number key thing. If you do this over and over and over again, it's exactly the way all the experienced nurses who've had 20 years like myself or more under their belt that can say, I can do ACLS in my sleep. So just as a little quote, as a note here, a lot of schools are revising their programs. So don't think you can find a school out there anymore that doesn't use some sort of simulation training. All right, so moving on. All right, Code Blue innovation for me, number one, is always to look a little bit sort of at the history. So let's kind of take a peek at that real quick. The first SimMan, the first design of one was Stefan Abramson, Dr. Stefan, and Dr. Judson Denson, who did the first Sim1 in the very late 1960s, almost 1970. But lo and behold, off of that, and I know everybody has at one time or another must have seen the Laerdal name. I don't know if I'm pronouncing it correct, but Asmund Laerdal was the one who invented the Resusci Annie, or Annie, are you still alive? Are you breathing? Quick, check a pulse. All right, so the face of Annie, which is very interesting. The mold came from a design of a beautiful face of a lady in a portrait in the Louvre Museum in Paris, France. Just a little hint there of where you can find ideas for developing your own ideas. All right, so technology innovation number two, what we do now. This is high fidelity simulation here, whereas before what I was just talking about with the original SimMan and Resusci Annie is low fidelity. Now the difference between those, high fidelity has electronics, technology, is responsive, say SimMan can blink their eyes, talk to you via someone in a crow's nest behind a one-way mirror, respond, listen to breath sounds, bowel sounds, etc. Whereas on the prior slide, low fidelity is more, you can push, you can practice your skills, you can do your CPR manipulation, maybe some mouth-to-mouth breathing, etc. However, you're not going to get a response from the other side of that. So high fidelity, you get a response. Low fidelity, not so much. So the big thing about high fidelity is that you are going to get confidence, reliability, again, the standardization we talked about. It helps with your performance. It helps develop for hospitals, clinics, and EMT services, quality assurance, utilization management. It helps dot the I's, check the T's, and make sure that, boy, you know what you're doing. We're not going to let you loose unless we think you know what you're doing. So basically, the already known quote versus what is needed to know. Okay, you need to know before you think you already know something. All right, so low and high fidelity. We cannot even evaluate ourselves into how we do in the simulation training until we know the pathway. The pathway basically for the introduction is you're going to go gather your materials. You're going to gather the patient chart. You're going to gather a simulation Cardex. You're going to know some background on Mr. Bob here, your simulation mannequin, before you go, potentially have to run a Code Blue on this patient. So you're going to have all your background information. Your instructor should be giving you a simulation learning template that you can either practice filling out, or you can have parts of it filled out and have to get together as a group and plan your method from there. So there's a little bit of intended learning outcome there. Data collection. Data collection falls under all the above. Your assignment, again, is going to expose you to clinical reasoning process. And this is very, very, very important because you're going to have to be able to document. You're going to have to be able to explain yourself. You're going to have to be able to prescribe what you are going to plan to do as you run the code. So further, that is going to give you feedback. Everybody in that room and everybody involved with you is going to give you feedback. And even though you're the team leader, you best be listening and make sure that you're paying attention to what a doctor ordered, or respiratory therapy said they just set the vent at, or that they finally got the ET tube down in the patient, or the IV is in. When you're calling out those things, even though you have a recorder, you should be making a mental note. And I will give you a tip that is one that I've sworn by over the years that I didn't learn until about 6 years into my career. I'm an ICU nurse by trade, and I also do trauma emergency polytrauma management at the bedside. I'm not just a manager, I'm a bedside. You take a nice wide piece of tape, you stick it on the leg of your pants, get yourself a Sharpie, and every time you hear something, you write it on the leg of your pants. You're guaranteed you're not going to miss anything. And when you process thinking your way through this thing, you'll look down and, oh yeah, I did that. Okay, keep going. All right, hint, hint. So that's your feedback. Feedback provides learning. Learning provides more feedback. What you did wrong, what you didn't do right, what went well, what didn't go so well. So and again, this is all centered around the patient. Patient number one, absolute patient number one. So then after your feedback, you're going to go into kind of a debrief process. Most simulations take anywhere from 30 minutes to an hour. It just depends on how much time your instructor or the controller trainer has to spend with you. So you're going to move on. You're going to have a reflection time. And again, the good, the bad, the not so great. And that falls under a thing called debriefing. Now, under Bachelor and under Gardner, 2015 and 2012, you'll find a lot of information about DASH, debriefing, assessment, simulation, and it's all copyrighted, and there is an actual instruction form. You will find that in my references. Underneath, I believe it is slide number 10. So pay attention to that, look that up, print that out. It's very, very, very helpful. So then once that debrief is done, you're going to recycle back through again. If it didn't go so well the first time, that's what's good about everybody taking turns having their 30 minutes. Somebody else is busy with some other project or looking up something else. So you're all going to take turns. You're going to have your scribe, you're going to have your, that is the recorder, you're going to have your IV person, your lab person, your airway person, which is also the oxygen person. You're going to have the person doing the CPR. You're going to have another person who's going to run for you. You're going to have another person who's going to be, usually the pharmacy person is going to show up at a code. So somebody's going to play the pharmacy person, is going to hand the drugs to the student who's going to administer the drugs. So, you're starting to talk about looking up to about 5 or 6 different people. Okay? So you're going to come out of the debrief, go right back into it again, and you're going to cycle all the way through. Patient first, okay? So onward. I was going to play you a little bit of the innovation number 3, which is a simulation Code Blue, but I do feel here that that would take, even though I trimmed it down to 1.5 minutes, I just don't believe that you'll really gain more from watching that, but I do have the link right here for you. And if you push play on here when you're, watching my PowerPoint, you're more than welcome to watch through it because I did narrow it way down. I got the most beneficial high points. So let's just stick with that. It's the interprofessional code simulation. It is exactly what I based this whole presentation on. And onward we go. We're going to go into how did it look? Well, the students did their full case study. They did their presentation history. They went over their medication list. It was all done prior to their performance. They were already fully orientated to the lab prior to the event. So they were able to do multiple roles. They changed out over rotations. Everybody got a turn. Everybody had really, really, really good practice. So again, team leader, team associate, scribe, medication administration, CPR, that O2, that's that ambu bag, the big blue one that you see sometimes on television, whatever, that people are breathing for the patient. Okay, I know you should know that by now if you're a second year BSN student. And again, just a brief overview, 20 minutes for simulation, 10 minutes to debrief, scenario restarts, and then your video, everything's always recorded of your section, is always saved and uploaded. So, even after the simulation day is done, your class can sit down virtually, have it up on a screen, and everybody can take turns watching their section of their performance, and everybody can put their input into what could be done better, what went great, and what was not so great. Okay, so interchangeable feedback, communication, team effort, patient first. All right, so getting into debriefing, the big thing about debriefing is it provides confidence, reliability, standardization, safety, quality assurance, utilization management, really explores and identifies performance gaps. And especially it provides organized debriefing ensuring your self-reflection, your quality, your safety, and it's always positive. Nobody should be yelling at anybody during a Code Blue performance. It's teamwork, communication. Future performance will always evolve through critical thinking. So I thank you. Here's my contact information and my phone number. Always remember, patient first. You're only as good as the person next to you. And without them, you're going to fail. Your bad day is only as bad as your next good day. All right? Thank you for participating in my class.